Okay, let's get started. I hope everybody can hear me. Welcome to KindlyMD webinar. My name is Tim Pickett. I am the founder and CEO of KindlyMD. We were formerly known as Utah Therapeutic Health Center and have changed the name of the company and expanded really our vision. And this webinar is my opportunity to kind of explain that vision, explain what we're all about here at KindlyMD, kind of explain the core part of what we have to offer people and patients, what we've learned maybe a little bit along the way. And I'm really excited to get back into generating this type of content and talking to patients and talking to people. So I am going to change my the way you see it. Okay, so welcome here to KindlyMD. So I'll start out with the mission statement of KindlyMD. We prescribe what is needed and we get rid of what is not. We create treatment plans that really make sense for people, for our patients, and with a goal of helping America and helping patients get off of opioids or reduce the use of unnecessary prescription medications. We use a combination of prescription management, mental health services, and the key from our history, alternative treatments that are, we call them non-opioid alternative medications. Some people call them cannabis or other alternatives. We want to bring compassion back to healthcare, and we want to bring the patient-centered approach back to healthcare because we feel like so much of healthcare is driven by hospitals, drug companies, and doctors. To explain a little bit about how we got here, you should understand that about 70% of people over 45 years old use a medication chronically. That means they're using a medication every single day for longer than 3 months. In medicine, we consider a chronic medication or a chronic illness something that lasts longer than 3 months. And a lot of people find that these medications don't really help or are not really helpful. So that is a really big part of what we are finding in our patients. There are about 100 million patients or people in America that have chronic pain every year. Right now, it's about 50 million people have chronic pain. About let's say 1 in 5 or 20% of people with chronic low back pain have taken a medication, an opioid medication, in the past 30 days. So that's a lot of people who take opioid medications. On the flip side, it's become much harder for patients to get pain medications, right? It's become much more dictated from the top down. And so we're not really treating patients' pain really well. We know we have a chronic pain issue. We know we have a lot of people on medications, but it just doesn't seem like we're managing that in a good way or in the best way that we can. 107,000 people died last year of opioid or of drug overdose. 100 million people, like I said, suffer from chronic pain every year. And a lot of patients are seeking alternatives to traditional prescription medication, but they don't quite know where to go, or they don't have somebody to listen to them. And they're not being honest with their primary care provider or their specialty prescriber, their surgeon, or even their oncologist about what they're using or what they're researching. We also know that there's a huge increase in awareness for mental health and the mental health stressors, the COVID pandemic, and frankly, like the politics and the war in Europe. These things are causing And life, really, the stress of life is causing a lot of mental health stressors, and they contribute to chronic medical illness, and they contribute to increasing prescription medication use. And over the past 3 years, that has been just exacerbated. So with all of that happening, let me introduce you to KindlyMD. We take a serious look, and we seriously take prescription medication, prescription medicine, we take behavioral health, and we take those alternative medicines. We take that alternative approach and we mash it all together to really focus on long-lasting whole person care, right? We don't want to just isolate each of these things outside of ourselves. For the past couple of years, we have focused really on the alternative medicine. We started integrating behavioral health, or introducing behavioral health in our system, and now we have added the prescription management. And one thing that I wanted to mention in the previous slide is that the stigma, right? If we go back here to these problems, the stigma of people who are taking opioids is very much similar to the people who use cannabis or use alternative medications. And that stigma, we saw it in the medical cannabis treatment, in the medical cannabis world, and we really tried to destigmatize that throughout our company's history and our patient care. But we also know that we can do a lot to destigmatize the medications that people are taking and treat people, again, in this whole person care approach by mashing all this stuff together. So I'm going to describe and go through kind of all three of these areas in a little more detailed way to describe kind of the KindlyMD way, or how this works. So the first thing that we want to talk about is that behavioral health piece. So KindlyMD has an integrated care model. And what that means is we take a team of a medical provider who can prescribe medication and manage medications, including antidepressants, anti-anxiety medication, pain medicine, opioids, narcotics, ADHD medications such as like Adderall. We take a prescriber like that. We embed a BHC, a behavioral health clinician, into every visit. So that tends to be a much better way to get outcomes that are better for patients. So what do I mean by that is, if you take the prescriber and the BHC and you put them together in the same practice, in the same room, with the same charting system, you're more cost effective for the patient. You have a way to focus on patient-driven outcomes, right? Because you're not isolating the patient caught in the middle between the prescriber and the behavioral health person, because 70% of antidepressants, for example, are prescribed by somebody that doesn't have access to psychiatry, doesn't talk to the clinician, the behavioral health person, doesn't talk to the therapist. So you have patients oftentimes that are going to their therapist a couple of times a month, and they're talking about their symptoms, their life, and how their life stressors are affecting them. You have them then go to their prescriber once every few months, or once a month, even if you have a pain doctor, and they're getting their prescriptions managed there. But those people aren't talking together, right? So the integrated care model, and this is a really detailed slide that I won't go through in a detailed way, but we are going all the way up to level 6 with KindlyMD. We are fully collaborating with the BHC in a transformed and integrated practice, which again, it makes it much more like meaning of life and symptom management driven, instead of just isolating the patient between these two separated worlds, right? That means that the BHC and the prescriber work in the same facility. They share practice space. The BHC will see the patient every single time they're in clinic. right? They have short visits, just like the prescriber or your doctor. They're very focused on a few key behavioral things. They can talk about medication management, and they can really help the patient improve their quality of life. But that's really the focus, is quality of life and that collaboration. So the second piece, you're talking about that alternative medicine piece. So at our previous name, Utah Therapeutic Health Center, we've become what I would consider as experts in alternative medicine. We are very, very good at helping people reduce their use of other medications. And this is a simple survey that we did over about 1,150 patients. And we asked them, have you reduced a medication in the past 6 months? And this is their answers. So if you tally all this up, it shows that 88%, almost 90% of our patients within 6 months reduce the use of a medication by at least 10%. 40% of patients have reduced the use of medications by an entire medication within 6 months. So we know that that is happening, and we know that that's an important piece of like what we are good at and what we can help patients with. And so we're going to allow patients to utilize alternative treatments like medical cannabis with that expertise in conjunction with the prescription management and the behavioral health piece. So we're going to mash that together and let people use both, right? Out in the open, without stigma, and without that, without worrying whether or not they're going to get kicked off their pain clinic contract, whether they need to be honest with their therapist, because we have therapists inside our office as well, in addition to the BHC. One of the questions that we have already is, somebody who already has a therapist, would they be better off sticking with their pain clinic? Well, I mean, certainly it's up to the patient, but if you want to be honest and have those people talk together, then you might give KindlyMD a try. If the therapist isn't talking to the pain management provider, that's one reason why we can help maybe a little bit better. And additionally, this is a great time. Anytime you have a question, throw it in the Q&A, and we can answer those kind of along the way. One of the things that this integrated care model allows us to do here is to add therapy on top of this monthly visit, right? So if we're seeing a patient every month for managing their prescriptions, let's say they're on pain medications and we're seeing them every month, that patient, let's say they fill a little early or they run out of medications a little bit early. One of the best parts about KindlyMD is we can treat that person like a patient, and we can say, what's happening? What's really going on with your life that you have increased pain and you're using your medications in a quick way, right? You're running out of medications early. And we can add therapy to that in the same practice right down the hall with the therapist. Not the BHC, a little different model, right? But we have access to that right in that integrated care model. So it's really, really great for patients who have what we would call disparate clinicians or disparate systems to kind of bring all that under one roof. And utilizing medical cannabis in a non-stigma way, right? In a way that helps patients with a medical approach, we feel like is something we already are comfortable with, and we want more people to be comfortable with it. So essentially, we want to bring this traditional healthcare standards to the alternative medicine industry. We also study the effects. If you go back to that graph, we study what is happening. How is this helping patients? What's working? We know that chronic pain, for example, lives in the emotional part of the brain, and it forms these calluses or these ruts in the thought process between the emotional part of the brain and the logical part of the brain. And we know that cannabis, for example, softens those connections. And so we want to study the effects of the prescription medication and the therapy and the BHC intervention and the medications. And we want to help the person who's next, right? We want to help our patients now. And we want to use that evidence and use that, it's evidence-based medicine, right? For you, for patients, for your mom, for your aunt, for the people who need it. We study the effects of these medications. And with the growing acceptance of alternative medications, especially even in the federal government now, we can study the use of non-opioid alternatives. And we can see, how does this team up with a prescription? How does taking half of your pain medicine and half of a gummy, for example, affect sleep in 100 patients? And then we can use that to help more and more people. One of the things that I think we've learned also in this traditional healthcare standards is that the cannabis industry and these alternative healthcare industries are somewhat of the Wild West. We've seen patients get scammed out of hundreds and hundreds of dollars for visits that didn't help them, and have traveled all over the state to get access to things that they needed. And so bringing traditional healthcare standards doesn't mean we become like corporate medicine. It just means that we know what privacy laws mean. We know how to take a blood pressure, right? We're prescribing these medications. And additionally, we are going to add insurance billing to this over the next little while so that we can see people within the same system that you're used to using insurance, right? We're not treating people with cannabis, we're treating their knee pain or we're treating their depression. So very, very excited about that piece as well. And helping people really reduce the use of non-necessary medications, because there's a lot of people on medications, and there's a lot of people who don't get access to the medications they need because of the stigma, specifically with pain medicine. And so we find that this model is really, really helpful for patients. So if you or somebody you know is interested or has a problem with what's happening right now in their healthcare, and they want comprehensive care, we're moving away from episodic care and acute illness to a whole person care, right? Quality of life and access to whatever patients need, patient-driven care, and that's really the KindlyMD model. And super excited about that. So this has been really a quick overview of KindlyMD, our model, that integrated care model, and embedding that behavioral health clinician into the practice, and what we call, this is like a merged practice, right? So you see the prescriber, and just like you would normally see, and then you see the BHC. Maybe you see the BHC first, and they help just the same. So it's like double the value for the money. Does anybody else have any questions that they want to type in? You can speak up as well. I can unmute people if we have any questions. We have a good number of participants in this webinar as well. One question that was asked is, are we going to add blood work testing, and compliance testing would go along with this? So for a typical pain practice, people are getting urine tested. So we call it honest, honest results. And if you're being managed, or if you have medications that are managed that are opioids or controlled substances, then periodically best practices is to test that, test your urine, make sure that the patient is actually using the medication that we're prescribing, as well as making sure that the patient isn't on medications that are harmful. Cocaine comes to mind, right? If somebody's using cocaine with their other medications, that could be really harmful. So we test for that. That's best practice. But it doesn't mean you're going to be fired as a patient per se if you come up honest, right? And we expect that, you know, THC and opioids might come up if we're managing both of those medications. Now, lab testing, like blood testing, additional testing, hormone testing, iron panels, that type of thing, absolutely, we can order those. We can get those drawn at a local lab. If that's better for the patient, we can draw those over the next couple of months. We'll be able to draw those in-house and send those off for results. So yes, we absolutely do that. A question on ADHD medication like Adderall or something that is for that condition. So yes, so our pricing right now is $249 for an initial evaluation. Existing patients in our MedCard program or any other program under KindlyMD get a coupon, can use a coupon, and you can call us for information about that. We have kind of a patient program to make that much cheaper for existing patients to see us, but $119 a month. $119 a month is our cost to manage controlled substance medications. So if you're on Adderall, for example, that's no problem. We manage that medication all the time. That's just part of what we do. And you get to see the BHC and the prescriber for the same amount. So if you're paying for something like that now, this is a much more comprehensive approach for really what the cost of a 1 month's insurance premium is. You can do that for the whole year, right? You could see us for the whole year to get that. So another question that we had was, what if I don't want to talk to a therapist just to get my meds? Well, that's okay. You definitely don't have to. BHCs are not therapists. So it's a big question and a question we get all the time. I don't want to have therapy every month. We're not talking about therapy. We're talking about like a life coach, right? Like 15 minutes with a life coach or an executive coach. I think if you're thinking of it like that and you give it a try, you'll find that it is very, very useful. Like having a really, really smart friend to talk to just for a minute, just to bounce some things off of, to get more out of life. And it's really helpful. But we also offer telemedicine visits intermittently if you can't make it. And those visits don't include the BHC. So you might not see the BHC every single time for your medications. We have a lot of providers who are involved in our program under KindlyMD with the medical cannabis program, and as we grow our provider list under KindlyMD for this type of management will also grow, and the sky's the limit. We have multiple locations across Utah, and we intend to help as many people as we can. And of course, that means jobs for clinic staff, providers, and BHCs and therapists. Question on whether or not you have to be 21 to see us. So currently we don't see children. Under 18 is considered pediatric, and 18 to 21 is kind of a middle ground. Our providers, anybody under 21 would need to talk to one of our providers and talk about their medical conditions before scheduling an appointment. So if you're over 21, no problem. If you're under 21, give us a call. Typically, we want those patients, or we're looking to treat patients that are over 18. Insurance came up again on a question, and that is currently, as of right now, we do not accept insurance, but we are credentialing all of our providers under Kindly for insurance. So within the next 3 months, so at the time of this recording, it's end of November 2022, and we should be accepting insurance by, I would say, mid-February or March 1st at the latest. Once we accept insurance, our ability to see people quickly will diminish because the demand will go up. And so over the next couple of months, is a good opportunity for patients to get in and see us and get started with us, because certainly those are the patients we'll keep, and we'll be able to get in quicker once we start accepting insurance. What are we doing? So when we talk about reducing medications, what are we doing to reduce those medications? So that's a great question, and one that's really patient driven. So some patients require medications for years, and some patients don't know that they actually don't need a medication tomorrow. So that's an individual patient care plan. I've taken care of patients who are on 3 medications, an antidepressant, a pain medicine, and an anti-anxiety medication. And as we've worked with the patient, they realize they don't really need the antidepressant. So that one went away first, and they felt fine. Everything though is patient driven. You don't have to come off your medications, but we do what's best for the patient, and we don't dictate one way or the other. We educate and we dialogue. Will my medical cannabis card show up on my pain medication report with Doppel or the controlled substance database? So that already exists. Your medical cannabis card already shows up as an icon under the Doppel report. And in the future, we anticipate that the same provider who is managing the medications needs to be the same provider that is managing the cannabis card, or at least the same practice. So that's being talked about in the legislative session. And so we anticipate, as medical cannabis and the medical community come together, that those will be something we'll want to look for. But you won't get kicked off our panel for having a med card. You can use both. You can use all the medications that we manage, including medical cannabis, at the same time. Let's see. Can somebody come to us just for therapy? Absolutely. So we have therapists in addition to the BHCs, and some BHCs will do therapy as well as do BHC work. And you can absolutely come to us for therapy, and you can use your insurance once we get that billing set up for that. Those sessions are the same cost, so $119 per session, $119 per month for the medication management, $119, make it easy, just one number. We also have a discounted price if you'd like 2 therapy sessions and the medication management together. You can look on our website, KindlyMD, for that information. The mental health program is with the therapist. The medication management program is with the BHC. So the distinction is kind of a fine line between the two, but they are a little bit different. Mental health and therapy, therapist, medication managing, BHC. Excellent. I think that's all the questions that we've had. If you have additional questions, you can reach out to us on the kindlymd.com website. Just hit contact us, fill out the form. We get back to people within 24 hours. We usually have somebody, if it's a business day, to call you back. You can chat with us online. You can visit us on YouTube, Facebook, anywhere, any of the local, right, or the national, or all of the things, right? All of those things. I'm excited to share this with you, and I'm excited to get started. This has been a long time in the making. I love this model. I love our work. Our patients mean a lot to us, and looking forward to talking to you more.